Hi, everyone, and welcome to USDTL's ToxTime titled Be Part of the Team, Identify and Assess for FASD. My name is Michelle McGraw, and Guida Brown is our presenter today. She holds a degree in journalism and management and has extensive experience in Kenosha County nonprofit sector. For over 13 years, she served as the executive director of the Hope Council on Alcohol and Other Drug Abuse. Additionally, Guida has worked with AM Community Credit Union and Women and Children's Horizons. She is an adjunct faculty member at several universities, runs Guided by Guida, and is certified in substance misuse counseling and related fields in Wisconsin. If you have any questions, please submit them in the Q&A section at any time during the session. We have a lot of attendees today, so we will try to answer the questions most relevant to the presenter's expertise during our limited Q&A time. Please note that the opinions presented in this session are those of the presenter and do not reflect any official policies or positions of USDTL. So let's get started with our discussion. Without further ado, I present to you Guida Brown.
Hello, I'm Guida Brown, the principal of Guided by Guida. I'm not an employee of USDTL, but I am grateful that they're allowing me to speak to you about this important topic. Fetal alcohol spectrum disorders are not rare. In fact, they're more prevalent than either autism or Down syndrome, but they are rarely diagnosed, denying services to those who need them to address immediate developmental concerns and to mitigate lifelong damage caused by prenatal alcohol exposure. Statistics indicate that about 5% of the population has an FASD. That's more than one child in every classroom. But diagnoses are lagging. Nearly 4 million children in the United States lives with an FASD. First, note that I didn't ask which of these children have fetal alcohol spectrum disorder or FASD. And that's because fetal alcohol spectrum disorder or FASD isn't a diagnosis. It's an umbrella term, and we'll get to later. Next, this is a trick question. No one can tell by looking at these children if they have an FASD. And that's why we're so glad that you're here. Let's have some caveats first. Someone with these features may not have FAS. There are other disorders that look like this. Likewise, someone who doesn't have these features may still have an FASD. Only about 10% of those affected by alcohol in utero have fetal alcohol syndrome. The other 90%, those who don't have those distinctive facial features, have a fetal alcohol spectrum disorder. So what can we do? We can educate ourselves and our patients and clients, explain that there is no safe amount, no safe time, and no safe type of alcohol to drink during pregnancy. We can advocate for awareness and prevention of substance-exposed pregnancies by using appropriate language. We can prevent and intervene. We can provide a screening and a brief intervention. We can test baby's umbilical cord tissue because substance use during pregnancy is underreported when a person is simply asked. And we can refer to services that provide lifetime resources. So, to reduce the risk of alcohol-related harms, how many daily drinks should a non-pregnant woman limit consumption to? I'm guessing that this is a surprise to some folks. For the record, binge drinking is 4 or more drinks for women or 5 or more drinks for men during an occasion. Heavy drinking is 8 or more drinks for women or 15 or more drinks for men during a week. And we know that a partner's abstinence is one of the best ways to ensure that a pregnant woman won't drink. Studies are beginning to show that sperm in chronic male exposure affects the formation of the offspring's brain, skull, and face as well. And no, you can't bank your drinks. You can't have more on Friday Just like I can't have 5 desserts on Friday because I skipped them through the week. Well, I can, but we know it's not healthy. So the USDA indicates that women should reduce their risks of alcohol-related harms by drinking no more than 1 drink in a day, or actually less than 1 drink in a day for women, and 2 drinks in a day for men. But alcohol is a toxin, so even drinking a little still leads to problems. Even drinking in moderation isn't considered safe drinking. Consumption leads to at least 7 different types of cancer, as are outlined here. So another little quiz here. Which has more alcohol? Is it a can of Miller, a glass of wine, or a shot of liquor? Kids always get this one right. I hope you do. The answer is a drink is a drink is a drink. Properly poured drink has the same amount of alcohol across the board. So again, this was a trick question. They all have the same amount. And if you're gonna drink, know how much you're drinking. So this is how we educate. I used to do an experiment for kids especially, and I had a shot glass, a wine glass, and a bottle of beer. And I would fill them up with water, the properly poured amount. So that's really important because a glass of table wine, that 5% of table wine, has to be properly poured. And I know of I don't even drink, and I know of places that overpour. So properly poured drink, a properly measured shot, a properly poured glass of wine, or a properly poured shot for a mixed drink. So I would have my drinks there, and then I would pour 1 drop of food coloring into those 3 beverages. And that food coloring explains the alcohol. It doesn't matter what the base is. It's the food coloring that's the alcohol that shows what's in there. So, I could go on and on trying to explain this, but basically a drink is a drink is a drink if it's poured properly. So when somebody says, oh, I just had 1 drink, but their 1 drink was a Long Island iced tea or, pure vodka martini, that's not 1 drink. Even when you go to a baseball game and you limit yourself to 1 drink, is it a bottle of beer or is it a poured glass, a draft beer that probably has 2 drinks, maybe even 2.5 in there? So it's really important to know what we're drinking. And then we advocate. Watch what you say and how you feel. According to the National Institute of Health, gestational age at time of pregnancy awareness is 5.5 weeks. That means that a pregnant woman could drink for nearly 6 weeks, not even realizing she's pregnant. So having an affected baby is not her fault, and she didn't choose alcohol over her baby. So samples of words that matter, things that we talk about, how we say these things. My goodness, it's not an FASD child any more than it's a crippled child or a paralyzed child. It's a child who has a child with. We always, always, always put the person first. We still far too often talk about clean and dirty tests. There's no such thing as a clean or a dirty test. A test is either positive or negative. There aren't, babies who are crack babies, where there are newborns exposed to cocaine, even crack cocaine. So this language is important. Once you get it in your head, you won't ever forget it. And I was just on a training the other day that talked about, and then what? So now I have the proper language, but what if my coworkers have it wrong or my friends have it wrong? And I always say to everyone around me who says it improperly, we don't say that. We don't say that. I have a niece who has a disability. I was in an ER once with her, and they called her I believe they called her the kid with seizures. And I went up to the window and said, "Hi, hi, I'm with the kid with seizures. How long are we going to be waiting?" Can you imagine how inappropriate that is? So we don't say it that way. We say we use language that expresses how we really feel. So make sure you really feel that you are there to help people. Watch what you say, watch what others say, and help everyone get it right. Here's what we know about the developing fetus. And so we believe that when there is alcohol on board during these times, this is what's being affected. So again, for that first 6 weeks, somebody might not know she's even pregnant, and that affects the brain, the heart, the arms, the legs, the ears to some degree, depending upon how long, the eyes. And so that's what you're seeing, that damage that's done early on. But even when somebody drinks in the second and third trimesters, there's still some concerns about that. So certainly stopping at any point is best. Making sure that people understand, alcohol is poison. It's a teratogen. It affects the brain. It causes damage. Babies who are born with babies who are born with a fetal alcohol spectrum disorder oftentimes have brain damage. It is throughout the entire embryo, not just one piece of it. So again, I don't want to overstate this, but it's really important. And once the damage is done, it's really important to stop too, to prevent further damage, as you can see here. So there's a great screening and brief intervention. We know that screening and brief intervention works. We know that people are willing to answer those questions. It's reimbursable, so you can get money in your healthcare practice for doing a screening and brief intervention. More than 90% of patients say they're comfortable answering alcohol screening questions from healthcare providers. We talk about using motivational interviewing, talking about how, if somebody says, "Oh yeah, I drink this much," well, what's your interest in, from 1 to 5, 1 to 10, what's your interest in drinking less? And they say it's a 3, and you say, well, why isn't it a 2? And then help them get up there to a higher number to drink less. So lots of great information that's free. Like I said, it's reimbursable. I have the resources here. And then if necessary, there's a great website, findtreatment.gov, that helps you figure out resources in your area to refer to treatment. Testing babies' umbilical cord. Previous studies have indicated that of those who are pregnant and indicate that they currently drink alcohol, 40% also indicate that they use other substances. But a recent paper indicates that that's really 58%. So that's a huge report of not indicating that what's on board, what's true. Of 238 ETG positive specimens, so alcohol in the specimen, 138, or nearly 58%, were positive for an additional substance or metabolite. 100 specimens were positive for only ETG, that 42%, whereas the other specimens were positive for one additional exposure was 88, 30, right around 37%. 2 additional exposures was 16%, 38 the number. 3 additional exposures was 10, about 4%, and 4 additional exposures was 2, about 1%. So they're saying folks will answer those questions. They'll say that, yes, I drank, but they won't necessarily accurately identify anything else, how much they drank, or what else they did aside from drinking. So The stigma around it causes people to underreport. And so we need to do a better job. And one of those better jobs is testing baby's umbilical cord tissue. It gives us an accurate picture of what's going on, and it helps both the mother and the neonate. This is not about taking them into custody. This is not about child abuse. This is about helping them to get the resources that they might need. It's not diagnostic, and I totally understand that. But pretending we don't know that there's a problem is not helping anybody. Testing and knowing if there's a problem will be able to allow for a referral to resources for both mom and baby. So then what happens? Statistics indicate that about 5% of the population has an FASD. Again, that's more than one child in every classroom. Nearly 4 million children in the United States live with an FASD. This disorder was discovered in 1975, and we're still talking about it as though it's brand new. We have got to do better, and a positive alcohol test result in umbilical cord tissue could be an early warning sign for the baby. Parents deserve it, and so do the babies. And then refer, refer, refer. You're not expected to have all the answers. So the next page is a short list of references that can help patients find services. And the last page is a list of references that can help you get more information and or training. Again, I can't overstate this. There are far too many people in our incarceration, our system of incarceration, children in our schools, far too many people who are walking around with a fetal alcohol spectrum disorder, and far too few are getting diagnosed. What we diagnose instead is autism, ADHD, and that is basically treating a cough when somebody has pneumonia. We're doing a terrible job of getting the help across the board, the full spectrum of help that folks need. So again, resources for general assistance, and then references in the presentation. I highlighted on the bottom the A1, Understanding Fetal Alcohol Spectrum Disorder Nurse's Role, because it's a really vital piece of information, and I encourage all of you to go to that. Any questions?
Subscribe to our channel to see more videos like this.